Hello and welcome back to Pure on the Road. I'm Sam Maricini once again from HIMSS 2022. And we talk a lot about healthcare. We talk a lot about infrastructure needs of our customers. But in reality, it comes down to business outcomes that are delivered by our partners. Like Tom Stafford, who is the healthcare CTO for CDW. Tom, welcome to the Pure booth.
Well, thanks for having me.
To our skybox.
Yeah, got a skybox. A little shaky, but
shaky. There's no problem there. It's absolutely perfect. So here's a question I have for you. So here at the Pure booth, we talk about consolidate, connect, protect, and that's what we want to deliver to our end users.
Yeah.
But what you're doing from your perspective is bringing the business outcome to that infrastructure.
Absolutely.
So what kind of conversations are you having here at HIMSS?
Well, it's a good year for HIMSS. We're finally back at it. But interesting enough, CDW is focused on clinical outcomes at this HIMSS. Hands down, we have if you come by our booth, you'll see Artisight, which is probably the most amazing tool, that the AI kind of tool that can do video inference, and it can help physicians and clinicians out day to day in everything they do. We also have clinical mobility, and we have virtual care too. So it's a different booth this year at CDW because we're all clinical focused. But the only way you can do clinical things is if you start with infrastructure, and that's why I'm here.
And we love that. And in fact, it's how that conversation comes together. Because what we want to do is make sure that our partners, like you guys, have the infrastructure you need to provide things like that clinical mobility.
But you can't do anything clinical unless you have a stable infrastructure. And what happens is Pure does that well. So at the end of the day, hospitals operate 24/7, 365.
Yes.
And so one of my mottos always when I was a CIO was 5 nines. You want to know why 5 nines is important? Because clinical care is 5 nines. Doesn't matter if you're life flighted in at 2 a.m. or you take your son or daughter to an urgent care clinic at 10 a.m. in the morning because they have a tummy ache, right? But at the end of the day, there's always a nurse and a physician there to care for you. And so everybody in IT has to be obligated to make sure that our systems are up 24/7. And that starts with storage. And you guys do storage well. And you do it packed. You have this evergreen model, which makes it very easy for CIOs because they know their costs forever. And not only that, but you upgrade things every 3 years, right? You get another version of the...
You get another version, right? Yeah. Data is the most important thing, and our evergreen model allows you to upgrade the components around it without having to do data migrations,
right? So
that you and your team at CDW can focus on those clinical outcomes.
And you're always on. Even when you upgrade, the system doesn't go down. And that's probably the most important thing. So end of the day, we're here for clinicians and physicians, but if you don't have that storage, and if we can't store that data in a very reliable method that's always on, then we can't do our jobs. Or the physicians and clinicians can't do their job.
It brings some options to that, like as a service utilities. Mm-hmm. We see a lot of that happening. So from CDW's point of view, is that big in terms of what customers are talking about?
Yeah, so like we're seeing this, I'm fortunate because I get to talk to people across the nation, and I'm seeing this trend right now where a lot of CIOs or chief digital officers right now are focused on their end users finally. I mean, we have to, because at the end of the day, if the clinicians can't do their job, why do we exist? And they're starting to look at the data center more as a commodity. But that's where you guys come in with your consumption model and things like that. So our CIOs and CTOs and CDOs can actually focus more on the clinicians, not worry about data anymore because it's always on and it works.
I love it, Tom. And that, we talked about it before we started. Yeah. It's like storage it's everywhere, but at the same time, the conversations are about clinical outcomes. It's about patients. It's about technology in the room with the patient.
Yeah, well, the best thing about storage is if you don't have to talk about it.
That's exactly what
it's a foundational and it works, but it has to work because outside of that, that's when you get into clinical outcomes and systems that actually help out our clinicians that better care for our patients. And that's literally why we're here.
Tom, thank you. So from our perspective, we're talking about consolidate, connect, protect. From CDW's perspective, it's a little different. Yeah. It's mobility, it's virtual care, but all of it works together to deliver for you, our customers.
Absolutely.
Tom, thanks for the time.
Great time. Thank you. Appreciate it.